Dietary changes. Hormonal changes. Identifying changes allows you to troubleshoot. Sometimes a simple adjustment, returning to a previous moisturizer, increasing stress management, or addressing dietary changes, restores clarity. For women, track your menstrual cycle and acne patterns indefinitely. If hormonal patterns are evident, you can prepare in advance during high-risk times with more aggressive treatment or preventative actions. Update your routine periodically based on new information. Skincare science evolves, new evidence-based ingredients and treatments emerge. While your core routine remains consistent, you might incorporate new additions. For example, if you weren't using sunscreen consistently but learn about new photostable sunscreen formulations, adding a good sunscreen enhances your results. However, don't constantly change your routine chasing new trends. Consistency matters far more than having the newest products. Have a plan if major breakout recurs. If despite your best efforts you experience significant acne recurrence, don't panic or feel you've failed. Contact your dermatologist to identify what changed and resume professional treatment if necessary. Sometimes life circumstances, severe stress, hormonal changes, medications, require adjusting your treatment approach. Your dermatologist can help. Celebrate achieving clear skin. Reaching this point likely required significant effort and patience. Recognize the achievement and the work that got you there. This perspective helps maintain motivation for long-term maintenance. Guide 20. Integrating all components, your complete personalized acne treatment and maintenance blueprint. After understanding individual components of acne treatment, integrating them into a comprehensive, personalized blueprint is essential. No single treatment works for everyone. Your specific acne type, skin characteristics, and lifestyle factors should guide your approach. Step 1. Accurately identify your acne type. Do you have comedonal acne, blackheads and whiteheads? Inflammatory acne, red pimples? Hormonal acne, deep cystic lesions around your jawline during specific times? Severe acne involving all types? Your acne type guides treatment selection. Comedonal acne responds best to salicylic acid exfoliation. Inflammatory acne responds best to benzoyl peroxide. Hormonal acne often requires systemic hormonal treatment. Severe mixed acne usually requires combination treatments and potentially professional intervention. Step 2. Assess acne severity. Mild acne, fewer than 20 comedones, fewer than 15 inflammatory lesions, no nodulocystic lesions, often responds adequately to topical treatments alone. Moderate acne, 20 to 100 comedones, 15 to 50 inflammatory lesions, no nodulocystic lesions, typically requires combination topical treatments, possibly with professional treatments. Severe acne, extensive lesions, numerous nodulocystic lesions, usually requires systemic treatment including oral antibiotics, hormonal treatments, or potentially isotretinoin. Step 3. Consider your lifestyle factors. Are you comfortable with multiple daily skincare steps? Can you prioritize sleep and stress management? Will you maintain consistency? These practical factors determine whether complex multi-step routines are realistic for you. Some people thrive with detailed routines, others do better with simplified approaches. Step 4. Design your core routine. Everyone benefits from a consistent cleanse, treat, moisturize, protect routine. Select specific products for each step based on your acne type. For comedonal acne, use a gentle cleanser, apply salicylic acid treatment, use a non-comedogenic moisturizer, apply sunscreen. For inflammatory acne, use a gentle cleanser, apply benzoyl peroxide treatment, use a moisturizer, apply sunscreen. For mixed or severe acne, consider consulting a dermatologist for prescription treatments. Step 5. Start conservatively with treatments. Begin with a single active ingredient at low concentration, using it 2 to 3 times weekly. After 3 to 4 weeks of good tolerance, assess results. If you're seeing improvement, continue. After 8 weeks, you can increase frequency or concentration if desired. If you're not seeing improvement after 8 to 12 weeks, consider adding a second treatment, for example, adding retinoid to salicylic acid, or consulting a dermatologist. Step 6. Build treatment combinations gradually. Never start 2 new treatments simultaneously. After establishing tolerance to your first treatment, at least 4 weeks, you can introduce a second treatment on different days or in different parts of your routine. For example, use salicylic acid cleanser in the morning, retinoid at night. Start the new treatment at low frequency and concentration, building up gradually. Step 7. Incorporate lifestyle changes. Implement dietary improvements, reduce sugar, increase antioxidants, consider eliminating dairy if it worsens your acne. Prioritize sleep, 7 to 9 hours nightly. Implement stress management, meditation, yoga, exercise, or other stress reduction techniques. These changes typically take 4 to 8 weeks to show skin effects but provide significant benefits. Step 8. Implement professional treatments if appropriate. If topical treatments aren't adequately controlling your acne after 8 to 12 weeks of consistent use, or if you have moderate to severe acne, professional treatments accelerate improvement. Monthly superficial chemical peels combined with your home routine provide excellent results. Professional facials or blue light therapy offer additional options. Step 9. Adjust for your specific factors. If you're a woman with hormonal acne, discuss hormonal treatments, oral contraceptives, spironolactone, with your gynecologist or dermatologist. If you're very acne-prone, you might need slightly more aggressive treatment than someone with occasional pimples. If your skin is sensitive, you'll need to progress more gradually with treatments. Step 10. Track your progress and adjust. Keep a skincare journal noting products used, frequency, side effects, acne status, stress levels, diet, and sleep. After 8 to 12 weeks, assess results. Have you seen improvement? Are side effects manageable? Are you ready to increase treatment intensity? Are you experiencing purging or adaptation? Adjust accordingly. Step 11. Set realistic timelines. Clear skin typically requires 8 to 12 weeks with topical treatments alone, potentially faster with professional treatments. However, residual hyperpigmentation and scarring may require additional time and treatment. Setting realistic expectations prevents discouragement from expecting overnight results. Step 12. Prepare for long-term maintenance. Once clear, continue your core routine indefinitely at maintenance levels. Don't expect to stop all treatments and maintain clear skin. Your skin's acne tendency hasn't fundamentally changed. Maintenance requires ongoing treatment, though frequency may decrease significantly. A sample complete routine for moderate mixed acne. Morning, gentle cleanser vitamin C serum, antioxidant protection, optional, non-comedogenic moisturizer SPF 30+ sunscreen. Evening, gentle cleanser salicylic acid toner or treatment, 3 to 4 times weekly initially, non-comedogenic moisturizer benzoyl peroxide spot treatment on active lesions or retinoid treatment, start 2 to 3 times weekly. Supplements, omega-3 supplementation, possibly zinc supplementation if deficient. Lifestyle, 7 to 9 hours sleep nightly, 30-minute exercise 5 times weekly, stress management through meditation or yoga, diet emphasizing whole foods and reducing sugar/dairy. Professional, monthly superficial chemical peels if available and affordable. This comprehensive approach addresses acne through multiple angles simultaneously. After 8 to 12 weeks of consistent implementation, you should see significant improvement. After 6 months, most people achieve clear or nearly clear skin. After a year, you've developed habits that maintain clear skin long-term. Remember, acne treatment is individual. What works perfectly for one person may not work for another. Patience, consistency, and willingness to adjust are more important than finding the perfect product. Most acne responds to consistent, appropriate treatment. It's a matter of identifying what works for your specific skin and persisting with it. You now have a complete understanding of acne pathophysiology, treatment options, professional treatments, lifestyle factors, and integration strategies. Armed with this knowledge, you can approach your acne treatment confidently, make informed decisions, and achieve and maintain clear skin. Your journey to clear skin is absolutely possible with proper treatment, professional guidance when needed, and consistent effort over time. Commit to the process, trust in evidence-based treatments, and clear skin will follow. 20 Advanced Skin Care and Acne Treatment Guides, Part 2. Each guide, 10 to 15 minutes reading time. Guide 21, Isotretinoin, Accutane, the definitive acne treatment for severe and resistant cases. Isotretinoin, commonly known by its former brand name Accutane, represents the most powerful acne treatment available. It's the only medication that can potentially cure acne permanently. However, its serious potential side effects mean it's reserved for severe, treatment-resistant acne and requires careful medical supervision. Understanding isotretinoin, its mechanism, effectiveness, requirements, and side effects, is essential for anyone considering this treatment. Isotretinoin is a vitamin A derivative, but far more potent than over-the-counter retinol or even prescription tretinoin. It works through multiple powerful mechanisms. First, it dramatically reduces sebaceous gland size and sebum production by up to 90%, essentially eliminating one of the 4 primary factors in acne development. Second, it normalizes follicular keratinization, preventing dead skin cell accumulation that leads to comedones. Third, it has powerful anti-inflammatory effects, reducing the inflammation driving acne. Fourth, it has some antibacterial properties, reducing Cutibacterium acnes populations. The combination of these mechanisms makes isotretinoin extraordinarily effective. Approximately 70 to 90% of patients achieve complete, long-term acne remission after 1 course of isotretinoin. Many patients are cured permanently, their acne never returns. Guide 1, Complete Understanding of Acne, Pathophysiology, Types, and Root Causes. Acne is one of the most prevalent skin conditions affecting approximately 85% of people aged 12 to 24, with significant numbers also experiencing adult acne. To effectively treat acne, you must first understand its underlying mechanisms and various manifestations. Acne develops through a complex process involving four primary factors: increased sebum production, follicular hyperkeratinization, colonization by Cutibacterium acnes bacteria, and inflammation. The sebaceous glands, which produce sebum or skin oil, become hyperactive primarily due to hormonal stimulation. During puberty, androgens like testosterone trigger increased sebum production. This oil production is essential for skin protection, but excess sebum creates an environment conducive to acne development. The sebaceous glands have androgen receptors, meaning individuals with heightened sensitivity to hormones or with hormonal imbalances experience excessive sebum production. Follicular hyperkeratinization refers to the abnormal shedding of skin cells lining the hair follicle. Normally, dead skin cells shed and exit through the hair follicle to the skin surface. In acne-prone individuals, these cells stick together and don't shed properly, creating a plug within the follicle. This plug, combined with sebum, forms an ideal environment for bacterial growth and acne formation. Cutibacterium acnes, previously known as Propionibacterium acnes, is a naturally occurring bacterium on human skin. However, in the oxygen-poor environment created by plugged follicles, this bacterium proliferates rapidly. These bacteria produce enzymes and toxins that trigger the immune system, causing inflammation and the visible acne lesions you see on your skin. Inflammation is the final component and arguably the most visible aspect of acne. When the immune system responds to bacterial presence and follicle rupture, it sends inflammatory cells to the area, causing redness, swelling, heat, and the formation of pustules or nodules. Understanding this process is crucial because different acne treatments target different components of this mechanism. There are numerous acne types, each requiring different treatment approaches. Non-inflammatory acne includes blackheads and whiteheads. Blackheads, or open comedones, form when a follicle is clogged with sebum and dead skin cells, but the pore remains open. The dark appearance results from oxidation of the sebum, not dirt. Whiteheads, or closed comedones, occur when the follicle is completely sealed, trapping sebum and dead cells beneath the skin surface, creating a small white or flesh-colored bump. Inflammatory acne is more noticeable and potentially scarring. Papules are small, firm, red bumps without a visible center, representing the body's inflammatory response. Pustules are similar to papules but contain a visible yellow or white center filled with pus. These are the classic pimples most people recognize. Nodules are larger, deeper, solid lesions that develop when inflammation extends deeper into the skin. They're typically painful and can last for weeks. Cystic acne represents the most severe form, where large, fluid-filled lesions develop deep within the skin. These are extremely painful and highly prone to causing permanent scarring. Several factors contribute to acne development beyond just hormones and bacteria. Genetics play a significant role. If your parents had severe acne, you're more likely to experience it too. Environmental factors matter considerably. Living in humid climates can exacerbate acne due to increased moisture promoting bacterial growth. Pollution and environmental toxins can clog pores and trigger inflammation. Stress hormones like cortisol increase sebum production and inflammation, explaining why acne often worsens during stressful periods. Diet influences acne more than previously thought. High glycemic foods rapidly spike blood sugar, causing insulin surges that trigger sebaceous gland stimulation and androgen production. Dairy products, particularly skim milk, contain hormones and proteins that may trigger acne in susceptible individuals. Omega-3 fatty acid deficiency promotes inflammation, while excessive omega-6 consumption without sufficient omega-3s creates an inflammatory imbalance. Certain medications, including corticosteroids and lithium, are known to trigger or worsen acne as a side effect. Recognizing your specific acne type and identifying contributing factors is the first step toward effective treatment. Some people have purely hormonal acne, while others struggle with bacterial acne, dietary triggers, or environmentally influenced breakouts. Understanding your personal acne profile allows you to select treatments targeting your specific problem rather than wasting time and money on ineffective solutions. Guide 2: Comprehensive Daily Cleansing and Preparation Routine for Acne-Prone Skin. The foundation of any successful acne treatment regimen is an appropriate cleansing routine. Many people underestimate the importance of proper cleansing, believing that any soap will suffice. However, for acne-prone skin, the cleansing process is far more nuanced and critical to success. Your cleansing routine will prepare your skin for treatment products and remove substances that promote acne formation. Begin by understanding that you should cleanse your face twice daily, once in the morning and once at night. Morning cleansing removes the oil, dead skin cells, and bacteria that accumulate overnight while you sleep. Your skin is active at night, producing more sebum and shedding dead cells, so morning cleansing is not optional. Evening cleansing is equally important, removing makeup, environmental pollutants, dirt, excess oil, and dead skin cells accumulated throughout the day. Many people neglect evening cleansing or do it hastily, significantly compromising their acne treatment results. Temperature matters more than most people realize. Always use lukewarm water, never hot water. Hot water strips away your skin's natural oils and disrupts the skin barrier, leading to increased irritation and compensatory sebum overproduction. Excessively hot water also causes blood vessel dilation, temporarily increasing inflammation and making acne appear worse. Conversely, cold water doesn't effectively remove oil and impurities, leaving your skin inadequately cleansed. Selecting an appropriate cleanser is crucial. For acne-prone skin, choose a gentle, pH-balanced cleanser specifically formulated for this skin type. The pH of your skin is approximately 4.5 to 5.5, slightly acidic. Using alkaline soaps disrupts this pH balance, damaging your acid mantle and increasing sensitivity and bacterial overgrowth. Look for cleansers labeled pH-balanced or for acne-prone skin. Many quality acne cleansers contain salicylic acid, a beta-hydroxy acid that penetrates into pores to dissolve sebum and dead skin cells. A concentration of 0.5% to 2% is appropriate for daily cleansing. Some people prefer cleansers with benzoyl peroxide, which kills acne-causing bacteria. A 2.5% benzoyl peroxide cleanser is effective without excessive drying when used in a cleansing format rather than as a leave-on treatment. Others prefer gentle, fragrance-free cleansers without active ingredients, particularly if their skin is sensitive or if they're using other strong acne treatments. Experiment to find what works best for your skin, understanding that what works for your friend may not work for you. The cleansing process itself requires attention to technique. Wet your face thoroughly with lukewarm water to open your pores slightly and soften your skin. Apply your cleanser using your fingertips or a soft washcloth. Using your hands is often preferable because you have better control and can feel whether you're applying too much pressure. Gently massage the cleanser into your skin using circular motions for approximately 30 to 45 seconds. This duration gives the cleanser time to dissolve oil and loosen impurities without overstripping your skin. Pay special attention to your T-zone, your forehead, nose, and chin, where sebum production is typically highest. However, don't neglect other areas, particularly your jawline and cheeks where hormonal acne often appears. Be especially gentle around your eyes and lips where skin is thinner and more sensitive. Never use a rough scrub or washcloth, as physical abrasion can irritate acne lesions, spread bacteria, and increase inflammation. After thoroughly massaging, rinse your face completely with lukewarm water. Ensure you remove all cleanser residue, as leftover cleanser can irritate your skin and interfere with the absorption of treatment products. Pat your face gently dry with a clean, soft towel. This is important. Never rub your face dry aggressively. Aggressive rubbing irritates inflamed acne, increases inflammation, and can spread bacteria to other areas of your face. Insulin surges, triggering increased sebaceous gland activity and androgen production, both of which worsen acne. Foods with high glycemic index include white bread, white rice, sugary beverages, refined cereals, and most processed snacks. Replace these with low glycemic alternatives: whole grain bread, brown rice, vegetables, legumes, and nuts. This dietary shift reduces blood sugar volatility and decreases acne-triggering hormonal responses. Dairy products, particularly milk, contain hormones and bioactive peptides that may trigger acne in susceptible individuals. Multiple studies demonstrate correlation between milk consumption and acne severity. The effect appears strongest with skim milk, likely because fat-soluble hormones are removed during processing, leaving bioactive peptides. If you consume significant dairy and struggle with acne, try reducing or eliminating dairy for 4 to 6 weeks to assess impact. Many people notice significant acne improvement after reducing dairy. If dairy doesn't appear to worsen your acne, you don't need to eliminate it. Omega-3 fatty acids reduce systemic and skin inflammation. Foods rich in omega-3s include fatty fish, salmon, mackerel, sardines, walnuts, ground flax seeds, and chia seeds. Eat omega-3 rich foods 2 to 3 times weekly or consider supplementation if dietary intake is insufficient. Studies show that increasing omega-3 intake improves acne, likely through inflammation reduction. Antioxidant-rich foods protect skin from free radical damage and reduce inflammation. Berries, blueberries, strawberries, raspberries, dark leafy greens, spinach, kale, colorful vegetables, carrots, bell peppers, tomatoes, and dark chocolate all contain powerful antioxidants. Eating colorful foods daily provides antioxidant support. Zinc supports immune function and skin healing. Foods rich in zinc include oysters, beef, pumpkin seeds, and chickpeas. Some evidence suggests zinc supplementation improves acne, particularly in zinc-deficient individuals. Typical supplementation is 25 to 30 milligrams daily. Don't exceed this without medical guidance, as excess zinc causes nausea and copper deficiency. Vitamin D plays roles in immune function and skin health. Sunlight exposure stimulates vitamin D production, but many people don't get adequate sun exposure. Vitamin D-rich foods include fatty fish, egg yolks, and fortified milk. Some people benefit from vitamin D supplementation, particularly during winter or in northern climates. Typical supplementation is 1,000 to 2,000 IU daily. Consult your doctor about appropriate dosing. Hydration deserves emphasis. Drinking adequate water, about 8 to 10 glasses daily, more with exercise, maintains skin hydration from within, supports detoxification, and promotes overall health. Proper hydration improves skin clarity and reduces compensatory sebum overproduction from dehydration. Limiting sugar and refined carbohydrates is perhaps the single most impactful dietary change for acne. Sugar causes inflammation throughout your body, worsens acne, and accelerates aging. Reducing sugar by replacing sugary beverages with water, limiting desserts, and avoiding processed foods with hidden sugar improves acne significantly. Most people notice improvement within 2 to 4 weeks of reducing sugar. Stress is a major acne trigger. Chronic stress increases cortisol production, which increases inflammation and androgen activity. Stress also triggers immune dysfunction, promoting bacterial overgrowth. Implementing stress reduction techniques is therefore essential. Meditation, yoga, deep breathing exercises, regular exercise, and time in nature all reduce stress and cortisol levels. Exercise provides multiple acne benefits. Regular aerobic exercise, 30 minutes, 5 days weekly, reduces stress, improves circulation, regulates hormones, and promotes overall health. However, exercise-related acne can occur from sweat and friction. Shower immediately after exercising, change into clean clothes, and avoid touching your face during exercise. Despite temporary exercise-induced acne risk, the overall benefits of regular exercise substantially outweigh risks. Sleep profoundly affects skin health. During sleep, your body releases growth hormone and reduces cortisol, supporting skin repair and reducing inflammation. Poor sleep increases cortisol, promotes inflammation, disrupts hormonal balance, and worsens acne. Consistently getting 7 to 9 hours of quality sleep significantly improves acne. Implement good sleep hygiene, maintain consistent sleep schedules, avoid screens an hour before bed, keep your bedroom cool and dark, and limit caffeine in the afternoon. Alcohol consumption worsens acne through multiple mechanisms. Alcohol increases inflammation, disrupts gut health, which influences skin and dehydrates skin. If you drink alcohol, do so moderately and ensure adequate hydration. Heavy alcohol consumption noticeably worsens acne in most people. Smoking impairs skin healing, increases inflammation, and worsens acne. Smokers typically have worse acne than non-smokers. Quitting smoking improves acne and overall health dramatically. Gut health increasingly appears important for skin health. Poor gut microbiota diversity, gut inflammation, and increased intestinal permeability, leaky gut, correlate with acne. Eating fermented foods, yogurt, kimchi, sauerkraut, fiber-rich foods, vegetables, whole grains, legumes, and possibly taking probiotic supplements supports healthy gut microbiota. While gut acne connections are still being researched, the evidence suggests supporting gut health helps skin. Hormonal regulation through lifestyle is important, particularly for women with hormonal acne. Regular exercise, stress reduction, adequate sleep, and healthy diet all support hormonal balance. For women with PCOS or obvious hormonal acne, these lifestyle factors may reduce symptoms enough to minimize or eliminate the need for systemic medications like spironolactone or oral contraceptives. Important perspective: diet and lifestyle changes typically take 4 to 8 weeks to demonstrate skin effects. Don't expect immediate results. However, after 8 to 12 weeks of consistent dietary and lifestyle improvements, most people notice significant acne improvement. These changes provide benefits beyond acne: improved energy, better sleep, improved digestion, and overall better health. Guide 15: Professional dermatological treatments, chemical peels, laser therapy, and advanced technologies. Professional dermatological treatments provide powerful acne management beyond what home skincare achieves. Understanding various professional treatments, their mechanisms, appropriate candidates, and realistic expectations helps you make informed decisions about whether professional treatment is right for you. Chemical peels use acids to remove skin layers, treating acne, scarring, and texture issues. Superficial peels penetrate only the outermost skin layer and are the mildest type. These use low-concentration acids, 15 to 30% salicylic acid or glycolic acid, and require minimal recovery and irritants to skin, worsening acne. Clean makeup brushes at least weekly with gentle shampoo or brush cleaner. Replace sponges frequently. Use clean hands or clean applicators when possible rather than dirty brushes. Removal of makeup is crucial. Leaving makeup on overnight allows prolonged contact with pores, promotes bacterial growth, and worsens acne. Thoroughly remove all makeup before bed using an appropriate makeup remover or cleansing oil, followed by your regular cleanser. Double cleansing, first with oil-based remover, then water-based cleanser, is particularly effective for completely removing makeup and sebum. Mineral makeup is often better tolerated by acne-prone skin than conventional makeup. Mineral formulations use zinc oxide, titanium dioxide, and iron oxides as pigments without some of the potentially problematic ingredients in conventional cosmetics. Many mineral makeup lines specifically formulate for acne-prone skin. BB creams and CC creams offer lighter coverage than full foundation while providing some color correction. These lighter formulations are often better tolerated by acne-prone skin than traditional foundations. If you need coverage, consider whether a BB cream provides adequate coverage before resorting to heavier foundation. Tinted moisturizers combine light coverage with hydration, often with less pore clogging potential than foundations. For those with mild acne or seeking light coverage, tinted moisturizers can be a good option. Sunscreen itself should be acne-safe. Many sunscreens worsen acne due to occlusive or comedogenic formulations. Specifically choose sunscreens for acne-prone skin, labeled non-comedogenic, oil-free, or for acne-prone skin. Mineral sunscreens are often better tolerated than chemical sunscreens. Testing new products carefully is essential. Introduce one new cosmetic at a time, using it for 1 to 2 weeks to assess whether it triggers new breakouts. If breakouts appear, discontinue the product and wait for acne to resolve before trying a different product. Testing one product at a time allows you to identify which products your skin tolerates. Some people find that minimizing overall makeup use helps control acne more than finding the perfect acne-safe products. If you use makeup only when necessary rather than daily, less product contact with skin means fewer breakout triggers. Consider whether you actually need all the makeup you're using or whether you could achieve similar results with less product. Professional makeup application services for special events often use heavy product application techniques. If you need professional makeup done, inform the makeup artist about your acne and request lighter application and acne-safe products if possible. Alternatively, request that you apply your own makeup at home after a professional provides guidance. The bottom line: find acne-safe products suitable for your skin, apply minimally, remove thoroughly, and use clean tools. This approach allows you to use cosmetics without significantly exacerbating acne. Guide 30. Building your perfect personalized skincare routine. Complete advanced framework. After understanding numerous acne treatments and supporting strategies, integrating all this knowledge into a personalized, optimized skincare routine that works specifically for your skin is essential. This comprehensive framework guides you through creating your perfect routine. Step 1. Identify your specific acne profile. Are you primarily comedonal, blackheads, whiteheads? Inflammatory, red pimples, pustules? Hormonal, deep cystic lesions? Severe mixed type? Fungal acne? Acne cosmetica? Your acne type guides which treatments are most appropriate. Comedonal acne particularly benefits from salicylic acid. Inflammatory acne responds best to benzoyl peroxide. Hormonal acne often requires systemic hormonal treatment. Fungal acne requires antifungal treatments. Getting your acne type right prevents wasting time on ineffective treatments. Step 2. Assess your skin type and sensitivities. Is your skin oily, dry, combination, or balanced? Very sensitive or robust? Do you have history of allergic reactions? Do you have rosacea or other reactive conditions? This information determines which products and concentrations your skin tolerates. Sensitive skin requires gentler products, lower active ingredient concentrations, and slower introduction of new treatments. Oily skin tolerates stronger treatments and higher concentrations. Dry skin requires careful moisturizing even while using drying treatments. Step 3. Evaluate contributing factors. What worsens your acne? Stress? Hormonal cycles? Certain foods? Sleep deprivation? Specific products? Environmental factors? Identifying contributing factors allows you to address root causes alongside medical treatment. If stress worsens acne, stress management becomes part of your treatment. If hormonal cycles worsen acne, tracking cycles and timing treatment adjustments helps. Step 4. Set realistic timelines and goals. Most acne improves over 8 to 12 weeks of consistent treatment. Severe acne might take 4 to 6 months or longer. Scars fade over 6 to 12 months with appropriate treatment. Setting realistic expectations prevents discouragement from expecting overnight results. Your goal might be clear skin or manageable acne with occasional breakouts, depending on your acne severity. Step 5. Design your morning routine. Start with a gentle cleanser appropriate for your skin type, used with lukewarm water. Follow with optional essences or hydrating toners if desired. Apply any morning actives, perhaps vitamin C serum for antioxidant protection. Apply your morning moisturizer. Finish with SPF 30+ sunscreen. This entire routine should take 5 to 10 minutes. Keep it simple so it's sustainable. Step 6. Design your evening routine. Start with makeup removal if applicable, oil-based cleanser or micellar water. Follow with your evening cleanser. Apply any evening hydrating toners or essences. Apply your primary acne treatment, perhaps salicylic acid or benzoyl peroxide, starting at low frequency, typically 2 to 3 times weekly. After allowing this to dry, wait 10 to 20 minutes, apply your moisturizer. If using retinoids, apply them now, after at least 2 to 3 weeks of tolerance building. Optional, apply occlusive oil or balm as final step if your skin is dry. Step 7. Plan your treatment introduction sequence. Never introduce multiple new treatments simultaneously. Introduce your first active treatment, perhaps salicylic acid, use it 2 to 3 times weekly for 3 to 4 weeks, then reassess. If tolerating well and seeing some improvement, after 4 weeks consider introducing a second active, perhaps benzoyl peroxide on different days/times. Build your routine gradually over 8 to 12 weeks. This patience is rewarded with better long-term results than aggressive starting. Step 8. Plan adjustments based on response. After 8 to 12 weeks of consistent treatment, reassess. Is acne improving? Are side effects manageable? Do you need to increase treatment intensity? Based on your assessment, you might increase frequency of treatments, increase concentration, add another treatment, or make other adjustments. However, only adjust one variable at a time so you know what caused any changes. Step 9. Incorporate lifestyle factors. Alongside your skincare routine, implement dietary changes, reduce sugar, increase antioxidants, perhaps reduce dairy. Prioritize sleep, 7 to 9 hours nightly. Implement stress management, meditation, exercise, or your preferred method. These factors take 4 to 8 weeks to show skin effects but provide significant benefits. Step 10. Plan professional treatments if appropriate. If after 12 weeks of diligent home care your acne hasn't adequately improved, consider professional treatments like chemical peels, laser, or blue light therapy. Monthly professional treatments combined with home care often produce better results than home care alone for moderate to severe acne. Step 11. Plan long-term maintenance. Once your acne clears, identify which treatments were essential for your success and continue them at maintenance levels. Your maintenance routine might be simpler than your treatment routine, perhaps just retinoid at night and sunscreen during the day, but it should continue indefinitely to prevent acne recurrence. Step 12. Build flexibility for adjustments. Your perfect routine isn't static. Seasonal changes, life stress changes, hormonal cycles, and other factors might necessitate routine adjustments. Have a plan for intensifying treatment during high-risk times, increased stress, menstrual cycle high-risk phase. Be willing to adjust your routine based on your skin's response rather than rigidly sticking to something not working. A sample personalized routine for moderate inflammatory acne might look like: morning, gentle cleanser niacinamide serum, optional, lightweight moisturizer SPF 30+ sunscreen. Evening, makeup removal if applicable, gentle cleanser hydrating toner/essence, optional, benzoyl peroxide 2.5%, 3 to 4 times weekly initially, moisturizer optional, retinoid, starting 2 to 3 times weekly after tolerance built. Lifestyle, 7 to 9 hours sleep, 30 minutes exercise 5 times weekly, stress management, diet emphasizing whole foods with reduced sugar. Professional, monthly superficial chemical peels if available. Timeline, 8 to 12 weeks for significant improvement, 6 months for near-complete clarity. This framework is meant as guidance, not prescription. Your perfect routine will be unique to your specific acne type, skin characteristics, lifestyle, and preferences. The principle is starting conservatively, progressing gradually, incorporating evidence-based treatments, addressing lifestyle factors, and maintaining long-term consistency. This approach works because it respects your individual skin while following scientific principles of acne treatment. Remember, there's no single, best, acne treatment. There's only the best treatment for your individual skin. Finding that treatment requires weeks or even months without fully resolving. Unlike typical acne that might be spread across the face, hormonal acne often appears in the same locations repeatedly. The hormonal pattern of acne is highly telling. Many women notice breakouts occur in a predictable pattern related to their menstrual cycle. Breakouts might appear 3 to 5 days before menstruation begins, resolve during menstruation, then reappear in the luteal phase, after ovulation. This cyclical pattern is a clear indicator of hormonal involvement. Some women break out only during specific phases of their cycle, while others experience breakouts throughout the cycle with worsening at predictable times. Hormonal acne results from heightened skin sensitivity to androgens, particularly testosterone and DHT, dihydrotestosterone. These male hormones stimulate sebaceous glands to produce more sebum, even in the presence of normal hormone levels. Additionally, androgens promote follicular hyperkeratinization and may increase colonization of acne-causing bacteria. Women's testosterone levels fluctuate with their menstrual cycle, with higher levels during the luteal phase, explaining the predictable timing of hormonal acne breakouts. Recognizing hormonal acne requires tracking your breakouts. Keep a calendar marking breakout dates and your menstrual cycle dates for 2 to 3 months. If breakouts cluster around specific menstrual cycle phases, hormonal acne is likely. Polycystic ovary syndrome, 𝒂𝒄𝒊𝒂𝒍, a condition affecting ovulation and hormone regulation, often causes severe hormonal acne. Women with 𝒂𝒄𝒊𝒂𝒍 typically have elevated androgen levels and irregular menstrual cycles. Topical acne treatments alone are often insufficient for hormonal acne. While they help manage symptoms, they don't address the underlying hormonal cause. Therefore, treating hormonal acne often requires systemic, oral, medications that regulate hormones or reduce skin sensitivity to hormones. Hormonal contraceptives are the first-line treatment for hormonal acne in women who desire birth control. The hormones in birth control pills suppress ovulation and, importantly for acne, reduce circulating androgen levels. Specifically, oral contraceptives increase sex hormone-binding globulin, SHBG, a protein that binds androgens and makes them unavailable to skin cells. The result is reduced sebum production and decreased follicular keratinization. Not all birth control pills are equally effective for acne. Combination pills containing estrogen and progestin are effective. However, some progestins have androgenic properties, meaning they act similarly to testosterone, and can worsen acne. Progestins with lower or no androgenic activity include norgestimate, desogestrel, and drospirenone. Birth control pills specifically approved for acne treatment by the FDA include orthotricycline, norgestimate, estrostep, norethindrone, yaz, drospirenone, and bayaz, drospirenone with additional vitamins. These pills typically show acne improvement after 3 to 4 months of use, with maximum improvement by 6 months. Starting a new birth control pill doesn't immediately improve acne. Acne often temporarily worsens in the first 1 to 2 months as your body adjusts to new hormone levels. This temporary worsening isn't a sign the pill won't work, it's normal. Stick with your chosen pill for at least 3 months before concluding it isn't working. If after 3 months acne hasn't improved, discuss switching to a different progestin or a different pill formulation with your gynecologist or dermatologist. Spironolactone is an alternative or complementary treatment for hormonal acne. This medication is a potassium-sparing diuretic that also acts as an androgen receptor antagonist, blocking androgens from affecting skin cells. Spironolactone is typically used at doses of 50 to 100 mg daily for acne treatment. It's often prescribed in combination with birth control pills for additional effectiveness. Spironolactone requires careful monitoring. Potential side effects include dizziness, lightheadedness, menstrual irregularities, and breast tenderness. More serious but rare complications include elevated potassium levels that can affect heart rhythm. Regular blood tests monitoring kidney function and potassium levels are necessary when taking spironolactone. Despite these considerations, many dermatologists consider spironolactone an excellent option for hormonal acne, particularly when combined with topical treatments and possibly birth control pills. Lifestyle factors significantly impact hormonal acne. Stress increases cortisol production, which increases androgen activity and sebum production. Implementing stress reduction techniques like meditation, yoga, regular exercise, and adequate sleep improves hormonal balance and acne. Regular aerobic exercise appears particularly beneficial for hormonal regulation. Diet influences hormonal acne through multiple mechanisms. High glycemic foods spike blood sugar and insulin, stimulating sebaceous gland activity and androgen production. Reducing refined carbohydrates and sugar while increasing complex carbohydrates, fiber, and whole foods helps regulate blood sugar and improve acne. Some research suggests dairy products, particularly skim milk, may trigger acne through hormonal pathways. Reducing dairy or switching to hormone-free milk might help if dairy appears to worsen your acne. Insulin resistance, common in women with PCOS, worsens hormonal acne. Reducing refined carbohydrates and sugar, eating regular meals with balanced macronutrients, and maintaining healthy body weight improves insulin sensitivity and can significantly reduce acne. Adding inositol supplementation may help with insulin resistance in some women. Discuss this with your healthcare provider. When to consider professional treatment for hormonal acne. If your acne is severe, widespread, or causes significant psychological distress, see a dermatologist and gynecologist together. If topical treatments haven't adequately controlled your acne after 3 months of consistent use, discuss systemic treatment options. If you suspect hormonal imbalances, irregular periods, excessive hair growth, fertility issues, see both specialists. Guide 8. Natural and evidence-based home remedies for mild to moderate acne. While prescription and over-the-counter acne treatments are scientifically validated and highly effective, several natural ingredients have research supporting their acne-fighting properties. These natural remedies can supplement professional treatments or be used alone for mild acne. Understanding which natural ingredients are evidence-based versus marketing hype is crucial. Tea tree oil is one of the most researched natural acne remedies. Multiple studies demonstrate its antibacterial and anti-inflammatory properties. Tea tree oil kills acne-causing bacteria and reduces inflammation associated with pimples. However, undiluted tea tree oil is irritating and can cause contact dermatitis, redness, and dryness. Always dilute tea tree oil with a carrier oil like coconut oil, jojoba oil, or argan oil before applying to skin. A typical dilution is 5 to 10% tea tree oil mixed with carrier oil. Apply this diluted mixture as a spot treatment to individual pimples using a cotton swab. Don't apply to your entire face, as this may be overly drying. Aloe vera has well-documented anti-inflammatory and antimicrobial properties. Pure aloe vera gel, applied directly from the leaf or as a pure gel product, soothes inflamed acne, reduces redness, and promotes healing. Aloe vera doesn't have the side effects associated with many acne treatments. It won't dry your skin excessively or cause irritation. Apply pure aloe vera gel as a spot treatment or all over your face as a lightweight moisturizer. Most people tolerate aloe vera well, though some experience mild irritation. If you're allergic to plants in the Liliaceae family, lilies, onions, garlic, you might react to aloe. Honey, particularly raw and manuka honey, has antimicrobial, anti-inflammatory, and healing properties. Raw honey contains enzymes and compounds that fight bacteria and reduce inflammation. It's gentle and suitable even for sensitive skin. Apply raw honey as an occasional face mask. Mix a small amount with water to create a spreadable consistency. Apply to clean skin for 10 to 15 minutes, then rinse with lukewarm water. You can do this 1 to 2 times weekly. Some people apply honey directly to pimples as a spot treatment. Honey is gentle, affordable, and many people find it effective for mild acne. Green tea contains powerful antioxidants called catechins that have antibacterial, anti-inflammatory, and sebum-reducing properties. Studies demonstrate that topical green tea application reduces acne severity. Brew strong green tea, allow it to cool completely, and use it as a rinse after cleansing, as a toner, or apply it to your face with a cotton pad. Alternatively, use a face mask or moisturizer containing green tea extract. Many commercial skincare products now include green tea for its antioxidant benefits. Most people tolerate green tea topically well, though those with sensitive skin might experience Most retinization symptoms peak at weeks 2 to 4 and resolve by weeks 6 to 8. However, expecting this phase mentally prepares you to persist through it rather than discontinuing retinoids prematurely. Managing retinization involves strategic moisturizing. The sandwich method, applying retinoid, waiting 20 minutes, applying moisturizer, waiting a few minutes, then applying another thin moisturizer layer, significantly reduces retinization severity while maintaining efficacy. As your skin adapts over 8 to 12 weeks, you can gradually stop using the sandwich method, eventually applying retinoid directly to dry skin. Buffering retinoid strength temporarily by mixing it with moisturizer reduces irritation without substantially compromising effectiveness. Some experienced retinoid users eventually apply retinoids directly to skin for maximum strength, while others continue using the sandwich method indefinitely because it works well for them. There's no wrong approach. Use whatever maintains your skin health while providing desired results. Niacinamide effectively reduces retinoid irritation. Using niacinamide serum in the morning and retinoid at night doesn't provide the irritation-reducing effect. However, some evidence suggests applying niacinamide before retinoid, allowing niacinamide to dry, then applying retinoid on top, might reduce irritation slightly. This is controversial, with some experts suggesting niacinamide interferes with retinoid efficacy, while others dispute this. For most people, using niacinamide and retinoid at different times is the safest approach. Ceramide-rich moisturizers particularly well support retinoid use by maintaining barrier health during treatment. Using moisturizers specifically formulated with ceramides, cholesterol, and fatty acids alongside retinoids helps prevent excessive dryness and irritation. Combining retinoids with other actives requires careful sequencing. Retinoids should not be combined with AHAs, BHAs, or vitamin C initially. After 12+ weeks of stable retinoid use, you might carefully introduce another active on different nights. Many experienced users successfully use retinoid nightly and salicylic acid or benzoyl peroxide on alternate mornings, but this requires well-adapted skin. Retinoid stability matters for effectiveness. Retinol degrades with light and air exposure. Products in opaque, airtight packaging remain stable longer than those in clear or non-airtight packaging. Storing retinoid products in cool, dark places preserves stability. Retinoids become less effective as they degrade, so proper storage extends product effectiveness and lifespan. Retinoid pulse dosing, using retinoids intensively for periods, then taking breaks, is a strategy some dermatologists recommend. The theory is that continuous daily use might cause adaptation, reduced effectiveness, while pulsing maintains efficacy. However, most retinoid experts recommend continuous daily use for consistent results. Occasional breaks for barrier repair are reasonable, but pulsing isn't necessary for maintaining retinoid effectiveness long-term. Combination retinoid protocols use multiple retinoids simultaneously for enhanced benefit. For example, using low-concentration tretinoin at night combined with retinol in the morning. However, this advanced approach requires very well-adapted skin and should only be attempted under professional guidance. It increases irritation risk and isn't necessary for most people. Pregnancy and retinoid use requires special consideration. Retinoids are teratogenic and should not be used during pregnancy. Women of childbearing potential using isotretinoin must use reliable contraception. Tretinoin used during pregnancy is controversial. Some studies suggest it's safe at prescribed topical doses where systemic absorption is minimal, while others recommend avoiding it. Discuss retinoid use with your obstetrician if planning pregnancy or pregnant. Adapting retinoid use seasonally may be beneficial. In winter, when skin is naturally drier, you might reduce retinoid frequency or concentration, or increase moisturizing support. In summer, if your skin tolerates it, you might increase retinoid frequency for more aggressive treatment. Signs of excessive retinoid use include severe dryness, persistent redness beyond the initial retinization phase, barrier compromise, or contact dermatitis. If you experience these, reduce frequency or concentration. There's no badge of honor for using the highest concentration or frequency if your skin is suffering. Optimal retinoid use maintains healthy skin while providing acne and anti-aging benefits. Guide 34. Sleep quality and acne, mechanisms, optimization strategies, and sleep-specific skincare. Sleep profoundly affects acne through multiple physiological mechanisms. Understanding sleep acne connections and implementing sleep optimization and sleep-specific skincare significantly improves acne. During sleep, your body undergoes restorative processes crucial for skin health. Growth hormone peaks during deep sleep, supporting skin repair and collagen production. Cortisol, the stress hormone, declines during sleep, reducing inflammation. Immune function is enhanced during sleep, supporting the body's ability to fight infection-causing bacteria. Cellular turnover occurs during sleep, with dead skin cells being replaced by new ones. All these processes directly support clear, healthy skin. Poor sleep disrupts these beneficial processes. Insufficient sleep, less than 7 hours nightly, increases cortisol, promotes inflammation, impairs immune function, and disrupts cellular turnover. The result is worsened acne within days of poor sleep. Many people notice acne worsening after only 1 or 2 nights of insufficient sleep, demonstrating sleep's direct acne effects. Sleep timing matters as much as sleep duration. Your body has a circadian rhythm, an internal clock regulating hormone release and physiological processes. Disrupted circadian rhythm, from shift work, irregular sleep schedules, or jet lag, worsens acne even if total sleep duration is adequate. Maintaining consistent sleep schedules, going to bed and waking up at the same times daily, optimizes circadian rhythm function and supports skin health. Sleep quality matters beyond duration. Fragmented sleep with frequent awakenings, even if total sleep time is adequate, compromises skin health. Poor sleep quality is associated with worse acne. Improving sleep quality requires addressing sleep disruptions through sleep hygiene optimization. Sleep position might influence acne through mechanical and bacterial mechanisms. Sleeping on your back avoids facial contact with pillows and your hands, reducing friction acne and bacterial transfer to your face. Sleeping on your side or stomach involves prolonged face pillow contact, increasing friction and bacterial exposure. However, changing sleep position is difficult if you're not accustomed to it. If you naturally sleep on your side or stomach, prioritize other acne management strategies rather than forcing an uncomfortable sleep position change. Pillowcase cleanliness significantly impacts acne. Dirty pillowcases accumulate bacteria, oil, and dead skin cells, all of which transfer to your face during sleep. Some dermatologists recommend changing pillowcases every 2 to 3 days for acne-prone individuals. Alternatively, sleeping on a clean towel over your pillowcase and changing the towel daily is effective and economical. Some people with severe acne benefit from silk or satin pillowcases, which create less friction and accumulate less bacteria than cotton. Bedroom temperature affects sleep quality. Warmer rooms increase perspiration, creating a moist environment promoting bacterial growth and acne. A cooler bedroom, around 65 to 68 degrees Fahrenheit or 18 to 20 degrees Celsius, supports better sleep and reduces nighttime sweating. If your bedroom is too warm, using a fan or air conditioning improves both sleep quality and acne through multiple mechanisms. Humidity in the bedroom affects skin and sleep. Excessively dry air, from heating systems or dry climate, irritates skin and disrupts sleep. Excessively humid air promotes bacterial growth and acne. Moderate humidity, 30 to 50%, is optimal. Using a humidifier in dry climates or a dehumidifier in humid climates optimizes sleep environment and supports skin health. Light exposure, particularly blue light from screens, suppresses melatonin production, disrupting sleep timing and quality. Using devices before bed worsens sleep through this mechanism. Stopping screen use 30 to 60 minutes before bed improves sleep quality. Using blue light filters on devices if evening screen use is unavoidable provides some protection. Severe acne. Preventing antibiotic resistance through early intervention with non-antibiotic treatments preserves antibiotic effectiveness if future antibiotics are needed. Starting with topical treatments rather than immediately jumping to oral antibiotics is prudent prevention approach. Education about acne myths prevents harmful behaviors. Teaching teenagers that acne results from poor hygiene, untrue, chocolate causes acne, unproven, or picking helps, false, prevents reinforcing these myths. Accurate education supports evidence-based prevention. Professional guidance for high-risk individuals might include dermatology consultation for those with strong family histories or early acne onset. Early professional involvement can prevent severe acne development. Guide 60, Acne Maintenance After Successful Treatment, the Forever Routine. Once you've achieved clear skin after acne treatment, maintaining clarity requires ongoing commitment to maintenance. Understanding long-term maintenance distinguishes between temporary acne control and permanent clear skin. The first principle of maintenance is recognizing that acne tendency doesn't disappear, it's managed. Your skin's predisposition to acne remains, but with appropriate ongoing treatment, acne stays controlled. This is similar to maintaining any chronic condition. You don't stop managing diabetes once blood sugar is controlled, you maintain management indefinitely. Maintenance routines are typically simpler than treatment routines. While treatment might involve multiple actives used frequently, maintenance often involves fewer treatments used less frequently. For example, someone might use salicylic acid daily and benzoyl peroxide daily during treatment, but maintain clear skin with just retinoid at night and benzoyl peroxide spot treatments as needed. Identifying essential treatments through your treatment experience guides your maintenance routine. Which treatments were crucial to your success? Continue those indefinitely. Which were helpful but not essential? Consider dropping these if your skin tolerates it, simplifying your routine while maintaining clarity. Seasonal adjustments remain important long-term. Winter might require slightly more moisturizing or reduced exfoliation frequency. Summer might require increased sun protection. These adjustments maintain skin health across seasons. Stress management, sleep, diet, and other lifestyle factors remain important long-term. While you might relax some during periods of stability, reverting entirely to poor habits causes acne recurrence. Maintaining reasonable health habits supports ongoing skin clarity. Monitoring your skin regularly allows early detection of potential recurrence. Monthly self-assessments identifying any new breakouts allows you to intensify treatment immediately if needed, preventing minor breakouts from progressing to significant acne. Having your dermatologist's contact information and willingness to contact them if acne recurs despite maintenance allows quick professional intervention. Don't try to solve recurrent acne alone for months, get professional help quickly. Keeping maintenance products on hand prevents running out and missing treatments due to product unavailability. Some people order backup products when current products are half empty, ensuring continuity. Reframing maintenance as self-care rather than burden improves adherence long-term. Your skincare routine is caring for your body's largest organ, supporting not just appearance but overall skin health and barrier function. The ultimate goal of maintenance is such consistency that skincare becomes automatic, habitual, and integrated into your daily routine like brushing teeth. At this point, maintaining clear skin requires minimal conscious effort. Guide 61: Understanding acne in specific sports and athletic activities. Different sports expose athletes to different acne triggers. Understanding sport-specific acne patterns allows targeted prevention and management for athletes. Swimming exposes skin to chlorine and often tight, non-breathable swimwear. Chlorine is drying and irritating, worsening acne. Frequent swimmers often experience acne on face, chest, and shoulders. Prevention includes rinsing thoroughly after swimming, removing chlorine quickly through gentle cleansing, using moisturizer afterward to combat dryness, and wearing clean, breathable clothing after swimming. Contact sports, football, wrestling, rugby, involve friction, pressure from equipment, and contact with other players' skin and bodily fluids. Helmet friction often causes severe acne along helmet edges. Prevention includes ensuring equipment is clean, using protective barriers, adhesive tape, where possible, showering immediately after contact, and maintaining aggressive acne treatment during the season. Running and jogging cause profuse sweating and friction from clothing. Prevention includes wearing moisture-wicking, breathable clothing, showering immediately after exercise, cleansing sweat off before acne develops, and using lightweight, non-comedogenic sunscreen resistant to sweat. Cycling involves friction from tight cycling clothing and helmet wear. Prevention strategies similar to other sports apply. Weightlifting and resistance training involve pressure from equipment, sweat, and friction. Focusing on cleanliness of equipment, showering immediately after workouts, and changing into clean clothes prevents sweat-related acne. Yoga and other activities with face-on-mat contact, yoga, Pilates, certain exercises, can cause acne if mats aren't clean. Using personal mats, washing them regularly, and avoiding touching your face during exercise helps. General athletic acne prevention across all sports includes showering within 1 to 2 hours after exercise, not wearing sweat-soaked clothing longer than necessary, cleansing face, neck, and areas covered by equipment, using clean towels, maintaining aggressive acne treatment during athletic seasons when acne tends to worsen. Working with dermatologists familiar with athletic acne helps develop sport-specific prevention and treatment plans. Some athletes benefit from temporary treatment intensification during seasons when their sport-specific acne triggers are highest. Guide 62: Acne treatment during immunosuppression and immune compromise. Immunosuppressed individuals, those with HIV, on immunosuppressive medications, with certain diseases, experience altered acne patterns and treatment responses. Managing acne in immunocompromised individuals requires special considerations. Severe acne with unusual presentations can indicate immune compromise in some contexts. If acne is unusually severe, doesn't respond to standard treatments, or has atypical features, immune status should be assessed. Immunosuppression can paradoxically worsen or improve acne depending on the specific immune alteration. HIV infection, particularly with low CD4 counts, is associated with worse acne and unusual presentations. Improving immune function through antiretroviral therapy often improves acne. Immunosuppressive medications, for transplant, autoimmune disease, or other conditions, sometimes worsen acne through various mechanisms. Managing acne in immunosuppressed individuals requires careful coordination with prescribers to avoid interactions and ensure appropriate acne treatment. Live bacterial vaccines are contraindicated in immunosuppressed individuals. This limits probiotic supplement options in severely immunocompromised people to non-viable probiotics, postbiotics, fermented foods. Isotretinoin should be used cautiously or potentially avoided in severely immunocompromised individuals due to risks of severe side effects and reduced healing capacity. However, isotretinoin can be used in mildly immunocompromised individuals with appropriate monitoring. Standard topical acne treatments are generally safe in immunocompromised individuals, though infection risk from acne stimulating sebaceous gland activity and follicular changes. This is why adolescent acne is so common and often severe. Acne's psychological impact during adolescence is particularly significant due to developmental sensitivity about appearance and social dynamics. Acne during formative teenage years can cause lasting psychological effects. Taking adolescent acne seriously and treating it appropriately is justified. Guide 98, Acne and Body Dysmorphic Disorder, Distinguishing Clinical Concern from Pathology. Body dysmorphic disorder, BDD, is excessive preoccupation with perceived appearance flaws, sometimes involving acne. Distinguishing between appropriate concern about actual acne and BDD helps ensure appropriate treatment. Normal acne concern involves recognizing acne exists, wanting to treat it, and feeling moderately bothered. This is appropriate and doesn't indicate pathology. BDD involves disproportionate distress about minor or imagined flaws, repetitive behaviors, mirror checking, skin picking, comparing, significant functional impairment, and disproportionate appearance focus. Someone with BDD focused on acne might have minimal actual acne but experience severe distress and dysfunction from perceived severe acne. BDD requires mental health treatment, therapy, sometimes medications, rather than dermatological treatment alone. Treating actual acne doesn't resolve BDD if actual acne isn't the primary problem. Recognizing BDD allows appropriate referral to mental health providers. Dermatologists familiar with BDD can identify it and recommend mental health evaluation. Having actual acne doesn't preclude also having BDD. Someone might have real acne and also have disproportionate BDD-related distress. Guide 99, Acne Treatment Optimization through N-of-1 Experimentation. N-of-1 trials involve testing treatments in yourself systematically to determine what works best for your specific skin. This personalized approach optimizes your individual treatment. N-of-1 testing involves trying one treatment change at a time, tracking results objectively, comparing periods with and without treatment. For example, testing whether dairy worsens your acne. Eliminate dairy for 4 weeks while maintaining everything else constant, track acne objectively, then reintroduce dairy and track acne again. If acne improved without dairy and worsens with dairy reintroduction, dairy is likely a personal trigger. Similarly, testing whether specific products, ingredients, stressors, or other factors affect your acne. Using single variable experimentation personalizes your treatment. Tracking variables, diet, sleep, stress, products used, acne status, in a detailed journal enables N-of-1 analysis revealing personal patterns. This personalized approach identifies your specific acne triggers and treatment responses better than general recommendations, since everyone's acne differs. Guide 100, Acne Future, Emerging Research, Potential Breakthroughs, and What's Next? Acne research continues advancing, with numerous promising approaches under investigation. Understanding emerging research provides hope for improved future treatments. Microbiome-targeted treatments using probiotics or postbiotics specifically addressing acne-associated microbiota changes are in development. These might provide more targeted bacterial management than broad-spectrum antibiotics. Precision medicine approaches using genetic testing to predict acne predisposition and treatment response are emerging. Personalized treatment based on genetic profiles might become reality. Immunotherapy approaches boosting immune response to acne bacteria or reducing inflammation are under investigation. Nanotechnology delivery systems enabling more targeted, deeper drug delivery are advancing. Future treatments might be more effective and have fewer side effects through optimized delivery. Gene therapy approaches, still experimental and far from clinical use, might eventually target genetic predisposition to acne. Plant-based and botanical treatments with stronger evidence are being developed. Future treatments might offer natural alternatives to synthetic drugs. Combination approaches targeting multiple acne mechanisms simultaneously are increasingly recognized as optimal. Future standard treatment might involve coordinated multi-mechanism attacks on acne. Artificial intelligence continuing to improve might eventually enable excellent personalized treatment selection and monitoring. Understanding that acne science advances constantly provides hope. Treatments available today vastly exceed what existed 20 years ago. Future treatments will likely be even better. Your acne is treatable now with current treatments. However, if current treatment's insufficient, future advances might provide new options. Either way, clear skin is achievable. Starting with gentle treatments is appropriate for adolescents. Many teenagers' skin is quite resilient and tolerates strong treatments well, but starting conservatively establishes good habits. Teaching proper skincare techniques during adolescence establishes lifelong habits. Involving adolescents in treatment decisions increases compliance. Understanding why treatments are recommended, how to use them properly, and what results to expect improves adherence. Adolescents who feel involved in their treatment are more likely to stick with routines. Addressing acne myths prevalent among adolescents: chocolate causes acne, poor hygiene causes acne, etc., prevents reinforcing false beliefs and harmful behaviors. Professional dermatology involvement is appropriate even for moderate adolescent acne, as dermatologists can recommend appropriate treatments and monitor for complications like scarring. Discussing how acne affects emotional well-being opens conversations about mental health support if needed. If acne is causing depression or anxiety, professional mental health support should be offered. Realistic expectations help adolescents understand that acne improvement takes weeks to months, not days. Understanding this prevents discouragement. Guide 68, Acne in Older Adults, Age-Related Changes and Treatment Adjustments. Acne persisting into or developing in older adults has unique characteristics requiring age-specific management adjustments. Adult acne in those over 40 or 50 is often hormonally driven, particularly in women during perimenopause and menopause, and typically more inflammatory than comedonal compared to teenage acne. Aging skin is a single active ingredient at low concentration, using it 2 to 3 times weekly. After 3 to 4 weeks of good tolerance, assess results. If you're seeing improvement, continue. After 8 weeks, you can increase frequency or concentration if desired. If you're not seeing improvement after 8 to 12 weeks, consider adding a second treatment, for example, adding retinoid to salicylic acid, or consulting a dermatologist. Step 6. Build treatment combinations gradually. Never start 2 new treatments simultaneously. After establishing tolerance to your first treatment, at least 4 weeks, you can introduce a second treatment on different days or in different parts of your routine. For example, use salicylic acid cleanser in the morning, retinoid at night. Start the new treatment at low frequency and concentration, building up gradually. Step 7. Incorporate lifestyle changes. Implement dietary improvements, reduce sugar, increase antioxidants, consider eliminating dairy if it worsens your acne. Prioritize sleep, 7 to 9 hours nightly. Implement stress management, meditation, yoga, exercise, or other stress reduction techniques. These changes typically take 4 to 8 weeks to show skin effects but provide significant benefits. Step 8. Implement professional treatments if appropriate. If topical treatments aren't adequately controlling your acne after 8 to 12 weeks of consistent use, or if you have moderate to severe acne, professional treatments accelerate improvement. Monthly superficial chemical peels combined with your home routine provide excellent results. Professional facials or blue light therapy offer additional options. Step 9. Adjust for your specific factors. If you're a woman with hormonal acne, discuss hormonal treatments, oral contraceptives, spironolactone, with your gynecologist or dermatologist. If you're very acne-prone, you might need slightly more aggressive treatment than someone with occasional pimples. If your skin is sensitive, you'll need to progress more gradually with treatments. Step 10. Track your progress and adjust. Keep a skincare journal noting products used, frequency, side effects, acne status, stress levels, diet, and sleep. After 8 to 12 weeks, assess results. Have you seen improvement? Are side effects manageable? Are you ready to increase treatment intensity? Are you experiencing purging or adaptation? Adjust accordingly. Step 11. Set realistic timelines. Clear skin typically requires 8 to 12 weeks with topical treatments alone, potentially faster with professional treatments. However, residual hyperpigmentation and scarring may require additional time and treatment. Setting realistic expectations prevents discouragement from expecting overnight results. Step 12. Prepare for long-term maintenance. Once clear, continue your core routine indefinitely at maintenance levels. Don't expect to stop all treatments and maintain clear skin. Your skin's acne tendency hasn't fundamentally changed. Maintenance requires ongoing treatment, though frequency may decrease significantly. A sample complete routine for moderate mixed acne. Morning, gentle cleanser vitamin C serum, antioxidant protection, optional, non-comedogenic moisturizer SPF 30+ sunscreen. Evening, gentle cleanser salicylic acid toner or treatment, 3 to 4 times weekly initially, non-comedogenic moisturizer benzoyl peroxide spot treatment on active lesions or retinoid treatment. Start 2 to 3 times weekly. Supplements: omega-3 supplementation, possibly zinc supplementation if deficient. Lifestyle: 7 to 9 hours sleep nightly, 30-minute exercise 5 times weekly, stress management through meditation or yoga, diet emphasizing whole foods and reducing sugar/dairy. Professional: monthly superficial chemical peels if available and affordable. This comprehensive approach addresses acne through multiple angles simultaneously. After 8 to 12 weeks of consistent implementation, you should see significant improvement. After 6 months, most people achieve clear or nearly clear skin. After a year, you've developed habits that maintain clear skin long term. Remember, acne treatment is individual. What works perfectly for one person may not work for another. Patience, consistency, and willingness to adjust are more important than finding the perfect product. Most acne responds to consistent, appropriate treatment. It's a matter of identifying what works for your specific skin and persisting with it. You now have a complete understanding of acne pathophysiology, treatment options, professional treatments, lifestyle factors, and integration strategies. Armed with this knowledge, you can approach your acne treatment confidently, make informed decisions, and achieve and maintain clear skin. Your journey to clear skin is absolutely possible with proper treatment, professional guidance when needed, and consistent effort over time. Commit to the process, trust in evidence-based treatments, and clear skin will follow. 20 Advanced Skin Care and Acne Treatment Guides, Part 2. Each guide, 10 to 15 minutes reading time. Guide 21, Isotretinoin, Accutane, the definitive acne treatment for severe and resistant cases. Isotretinoin, commonly known by its former brand name Accutane, represents the most powerful acne treatment available. It's the only medication that can potentially cure acne permanently. However, its serious potential side effects mean it's reserved for severe, treatment-resistant acne and requires careful medical supervision. Understanding isotretinoin, its mechanism, effectiveness, requirements, and side effects, is essential for anyone considering this treatment. Isotretinoin is a vitamin A derivative, but far more potent than over-the-counter retinol or even prescription tretinoin. It works through multiple powerful mechanisms. First, it dramatically reduces sebaceous gland size and sebum production by up to 90%, essentially eliminating one of the 4 primary factors in acne development. Second, it normalizes follicular keratinization, preventing dead skin cell accumulation that leads to comedones. Third, it has powerful anti-inflammatory effects, reducing the inflammation driving acne. Fourth, it has some antibacterial properties, reducing Cutibacterium acnes populations. The combination of these mechanisms makes isotretinoin extraordinarily effective. Approximately 70 to 90% of patients achieve complete, long-term acne remission after 1 course of isotretinoin. Many patients are cured permanently, their acne never returns. Of those who do experience some acne recurrence, it's typically mild and easily manageable with topical treatments, a vast improvement from their initial severe acne. Isotretinoin's effectiveness is why it's considered the gold standard for severe acne. The trade-off of potential side effects is justifiable when dealing with acne severe enough to cause permanent scarring or significant psychological distress. However, isotretinoin is teratogenic, meaning it causes severe birth defects if taken during pregnancy. This is the primary reason for its strict regulation and monitoring requirements. Any woman of childbearing age must use 2 reliable contraception methods while on isotretinoin and for 1 month after stopping. Monthly pregnancy tests are mandatory. This requirement, while burdensome, has made isotretinoin a reasonably safe option when guidelines are followed. Isotretinoin requires enrollment in the 𝑭𝒂𝒄𝒊𝒂𝒍 program in the United States. This program mandates monthly office visits, monthly laboratory tests, and strict documentation of contraception use for women. Prescribers must be registered, pharmacies must be registered, and patients must comply with all requirements. While this oversight seems excessive, it exists to prevent the tragic scenario of a teratogenic medication being used during pregnancy. Typical isotretinoin dosing is 0.5 to 1.0 mg/kg daily, with cumulative dosing targets of 120 to 150 mg/kg for optimal outcomes. A person weighing 70 kilograms might receive 35 to 70 milligrams daily. Treatment duration typically lasts 4 to 6 months, depending on dosing and individual response. Higher cumulative doses correlate with lower relapse rates. Common side effects of isotretinoin include severe dryness affecting skin, lips, and mucous membranes. Lip dryness is nearly universal. Most patients require intensive lip balm use throughout treatment. Dry skin often requires frequent application of heavy moisturizers. These side effects, while uncomfortable, are manageable. Using a humidifier, applying moisturizer multiple times daily, using occlusive lip balms, and using artificial tears for dry eyes all help manage these effects. More serious potential side effects include birth defects, hence the strict contraception requirements, elevated liver enzymes, elevated triglycerides, requiring dietary management or medication, depression and mood changes, inflammatory bowel disease, and rare severe reactions. These serious side effects necessitate baseline laboratory testing, monthly laboratory monitoring, and careful symptom assessment. Any concerning symptoms should be reported to your dermatologist immediately. Depression and mood changes are particularly concerning. Consistent routines in consistent order reduce sensory overwhelm. Number 50 Specialized Skin Care and Acne Treatment Guides, Part 4. Each guide, 10 to 15 minutes reading time. Guide 51, Acne During Menstrual Cycle, Tracking, Prediction, and Strategic Treatment Timing. Understanding how your menstrual cycle affects acne allows you to predict breakouts and strategically time treatments for maximum effectiveness. This is particularly valuable for women with cyclical hormonal acne. For confirmed acne cosmetica, switching to acne-safe alternatives of the product category often resolves the issue. Switching to non-comedogenic foundations, powder-based makeup instead of cream-based, or lighter formulations often allows makeup use without acne worsening. Reading ingredient lists helps identify potentially problematic components. Becoming familiar with ingredients triggering your personal acne helps you avoid them. Some people maintain lists of problematic ingredients to check against when considering new products. Patch testing new products on a small area, behind your ear or on your jaw, before full face application helps identify problematic products before they cause widespread acne. This 1 to 2 week trial prevents wasting money on products that trigger acne. The relationship between acne cosmetica and other acne factors is important. Someone might have both hormonal acne, from internal factors, and acne cosmetica, from products. Addressing both simultaneously, using acne-safe products plus treating hormonal acne medically, provides the best outcomes. Makeup artists and dermatologists can recommend acne-safe product alternatives for people who require makeup professionally. Many professional-grade acne-safe makeup lines exist specifically for people needing makeup without triggering acne. Guide 53. Acne mechanica, friction and pressure-related acne. Acne mechanica results from friction, pressure, or occlusion of skin and can be prevented through environmental and behavioral modifications. Understanding acne mechanica helps you prevent this preventable form of acne. Acne mechanica appears where friction or pressure occurs, under helmet straps, where backpack straps compress skin, where tight athletic equipment contacts skin, or where repetitive hand-face contact occurs. This acne is localized to pressure-bearing areas rather than distributed across the face. Friction from repetitive skin-on-surface contact, athletes rubbing faces on towels, workers constantly resting their faces on hands, can trigger acne through mechanical irritation and follicle disruption. Occlusion, trapping sweat and bacteria under non-breathable materials, creates ideal conditions for acne. Wearing tight, non-breathable clothing or equipment increases acne in that area. Prevention strategies include wearing loose, breathable clothing, ensuring athletic equipment is clean, using protective barriers, adhesive taping where possible, between skin and friction sources, and maintaining good hygiene in high-friction areas. Post-exercise hygiene is crucial for athletes. Showering immediately after exercise, changing into clean clothes, and cleansing areas where equipment contacted skin helps prevent friction acne. Some athletes find that using antiperspirant before exercise reduces sweat-related friction and bacterial growth. Hairstyles causing friction, tight braids, tight buns, can trigger acne on the scalp and forehead. Occasionally loosening hairstyles, using gentler hair-holding methods, or alternating hairstyles reduces friction acne. Phone contact with your face transfers bacteria and causes friction acne on the jawline and cheek. Using earbuds or speakerphone when possible, cleaning your phone screen regularly, and taking breaks from phone use reduce this contact-related acne. For occupational friction acne, workers in certain industries, workplace modifications and protective equipment prevent acne. Ensuring clean, breathable protective equipment and maintaining good hygiene at work helps control occupational friction acne. Acne mechanica is often preventable through simple environmental modifications. Unlike acne requiring medications, friction acne responds to preventing the friction. This makes acne mechanica particularly frustrating when it occurs since prevention is often simpler than treatment. Guide 54. Drug-induced acne and medication side effects. Certain medications trigger or worsen acne as a side effect. Recognizing drug-induced acne allows you to work with prescribers to modify medications or manage acne while necessary medications are continued. Corticosteroids commonly trigger acne or worsen existing acne. Systemic corticosteroids, oral, are more likely to cause acne than topical steroids, though topical steroids applied to face can also trigger acne. Patients on chronic systemic corticosteroids often experience significant acne requiring aggressive treatment. If corticosteroids are necessary, combining them with acne treatment is often required. Lithium, used for bipolar disorder treatment, causes acne in many patients. The mechanism involves effects on follicular epithelium and sebaceous gland function. Acne from lithium is sometimes severe. Working with your psychiatrist on whether alternative mood stabilizers are possible, or combining lithium with aggressive acne treatment, might be necessary. Anabolic steroids cause severe acne in nearly everyone using them. Anabolic steroid use for performance enhancement causes acne that often requires isotretinoin for management. The acne is typically severe, widespread, and on the trunk as well as face. Hormonal contraceptives can either improve or worsen acne depending on the specific formulation. Progestins with androgenic properties, like levonorgestrel or norgestrol, might worsen acne, while progestins with minimal androgenic activity, like norgestimate or drospirenone, often improve acne. If birth control is worsening acne, switching to a formulation with less androgenic progestin often helps. Anti-seizure medications sometimes worsen acne through various mechanisms. Working with your neurologist if seizure medications are worsening acne might identify alternatives or necessitate aggressive acne management. Vitamin B12 supplementation can paradoxically worsen acne in some individuals through unknown mechanisms. If you take B12 supplements and notice acne worsening, discontinuing B12 might help. The menstrual cycle consists of phases with distinct hormonal profiles affecting acne. The menstrual phase, days 1 to 5, involves shedding of uterine lining with declining hormone levels. Many women experience least acne during this phase as hormones are low. The follicular phase, days 6 to 14, involves increasing estrogen as follicles develop. Estrogen rise typically improves skin as estrogen has protective effects. Many women notice clearest skin during this phase. Ovulation, day 14, involves hormonal surge of LH and FSH. Some women experience minor acne worsening around ovulation. The luteal phase, days 15 to 28, involves rising progesterone and maintained estrogen. This phase often brings worsening acne in hormone-sensitive women due to progesterone effects and androgen to estrogen ratio changes. Tracking your acne patterns against your menstrual cycle for 2 to 3 months reveals your personal pattern. Many women find breakouts clustered in the luteal phase, particularly the 5 to 7 days before menstruation. However, individual patterns vary significantly. Some women have no cyclical acne pattern, while others have severe luteal phase breakouts. Once you identify your cyclical pattern, strategic treatment timing can optimize results. If you break out mainly in the luteal phase, intensifying acne treatment frequency during this phase can prevent significant breakouts. For example, if you normally use salicylic acid 2 to 3 times weekly, you might increase to daily use during your high-risk luteal phase. This temporary intensification often prevents the severe breakouts that would otherwise occur. Planning professional treatments around your cycle optimizes results. Having a chemical peel or professional facial during your clear follicular phase when your skin is less inflamed and more resilient provides better results than during your breakout-prone luteal phase. Hormonal contraceptives can help by suppressing ovulation and stabilizing hormone levels. Many women find that switching to birth control pills with continuous hormone dosing, tricyclic or extended cycle pills that reduce or eliminate placebo weeks, significantly reduces cyclical acne by preventing the hormonal fluctuations driving breakouts. Spironolactone, anti-androgen, helps some women with cyclical acne by blocking androgen effects. However, effects are more modest for pure cyclical acne than for chronic hormonal acne. Dietary modifications might help cyclical acne through hormone metabolism. Some evidence suggests that supporting liver health through adequate nutrients supports estrogen metabolism. Consuming adequate B vitamins, magnesium, and fiber supports hormone metabolism. PMS supplements containing ingredients like calcium, magnesium, and vitamin B6 might help with luteal phase acne through their effects on hormone metabolism and inflammation. Some women find these supplements modestly helpful. Stress during the luteal phase exacerbates acne in many women. The luteal phase naturally involves slightly increased anxiety and mood sensitivity. Implementing additional stress management during this phase, extra exercise, meditation, or relaxation practices, can reduce acne by controlling stress hormonal interactions. Sleep quality often decreases in the luteal phase due to progesterone effects. Prioritizing sleep during this phase through good sleep hygiene, potentially with earlier bedtimes, supports skin health. Understanding your cyclical acne pattern allows realistic expectations and strategic planning. Rather than being frustrated by predictable breakouts, you can anticipate them and proactively manage them. This empowerment often improves both skin outcomes and psychological well-being around acne. Guide 52, Acne Cosmetica, Product-Induced Acne and Ingredient Avoidance. Acne cosmetica specifically refers to acne triggered or worsened by cosmetic products. Understanding this condition and identifying problematic ingredients prevents wasted time and money on ineffective acne treatments when the actual problem is product-induced acne. Acne cosmetica differs from typical acne in that stopping the offending product often resolves it completely, whereas typical acne persists despite good skin care. This distinction is diagnostically important. If your acne improves dramatically after discontinuing a specific product, acne cosmetica was likely the cause. Common culprits in acne cosmetica include foundations, particularly heavy, silicone-based ones, primers, concealer, powders, sunscreen, and heavy moisturizers. These products can clog pores through their occlusive nature or irritating ingredients. Specific ingredients commonly triggering acne cosmetica include dimethicone. Simple treatments, typically 3 to 6, provide progressive improvement. Laser resurfacing works for all scar types but is most effective for shallow scars and ice pick scars. Dermal fillers inject material beneath scars to fill depressions temporarily. Different fillers last varying lengths. Some last 6 months, others 1 to 2 years. This approach works well for ice pick and boxcar scars but requires repeat treatments. Filler results are immediate, making this attractive for short-term improvement. Microneedling creates controlled microinjuries, stimulating collagen production and remodeling scarred tissue. Multiple sessions, typically 4 to 6, provide progressive scar improvement. Microneedling works for all scar types and is relatively affordable compared to laser treatments. Chemical peels can improve shallow scars through repeated treatments. TCA, trichloroacetic acid, peels at medium depth can improve scar appearance, though results are less dramatic than laser or microneedling. Treatment selection depends on scar type, depth, and individual factors. Dermatologists typically recommend combination approaches, perhaps subcision combined with microneedling, or laser resurfacing combined with fillers. Severe, extensive scarring might warrant multiple treatment types performed sequentially. Realistic expectations are essential. Most scars can be significantly improved but rarely completely eliminated. Even after multiple treatments, mild scarring typically remains. However, significant improvement is usually achievable with appropriate treatments. Guide 13. Face masks and professional facials for acne management. Face masks and professional facials supplement your daily skincare routine, providing concentrated treatments and professional expertise. Understanding various mask types and facial treatments helps you select appropriate options for your skin concerns. Clay masks absorb excess oil and impurities, making them ideal for oily, acne-prone skin. Green clay and kaolin clay are particularly effective. These masks draw out sebum, bacteria, and impurities from pores. Use clay masks 1 to 2 times weekly for 10 to 15 minutes on clean skin. Apply evenly, avoiding the eye area. As the mask dries, you'll feel slight tightening as oil is extracted. Rinse with lukewarm water and follow with moisturizer, as clay masks can be drying. Sheet masks infused with acne-fighting ingredients like salicylic acid, tea tree oil, or niacinamide provide targeted treatment and hydration simultaneously. Apply sheet masks to clean skin for 15 to 20 minutes, then remove and pat remaining serum into skin. Use 2 to 3 times weekly. Sheet masks are convenient, mess-free, and come in numerous formulations targeting specific concerns. Hydrating masks with hyaluronic acid, glycerin, or ceramides balance skin and prevent overdrying from acne treatments. These masks are essential if your acne treatment regimen is causing excessive dryness. Use hydrating masks 1 to 2 times weekly, particularly on days when you're using strong actives like retinoids or chemical exfoliants. Mud masks similar to clay masks draw impurities from pores while providing mineral content. Some formulations include additional active ingredients. Use similarly to clay masks, 1 to 2 times weekly for 10 to 15 minutes. Charcoal masks draw impurities from deep within pores. While popular, they can be overly drying. Use sparingly, perhaps monthly, if you have very oily skin. Avoid if your skin is dry or sensitive. Overnight masks are left on overnight and act as intensive treatments. Some are essentially very rich moisturizers, while others contain actives like retinol or acids. These work well for providing intensive treatment without time constraints. Apply as your final nighttime step and sleep with the mask on. Spot masks apply highly concentrated treatments to specific areas rather than your entire face. These are useful when some areas are more problematic than others. Apply to clean skin and leave on as directed. Important mask principles. Never use multiple mask types on the same day. Choose one mask per skincare session. Always follow mask application with appropriate moisturizer, as masks can be drying. Start with masks once weekly, increasing frequency only as your skin demonstrates tolerance. Don't leave masks on longer than recommended. Longer application doesn't mean better results and risks overdrying. Masks are supplements to your core routine, not replacements for daily cleansing and treatment. Professional facials go beyond at-home masks, utilizing professional strength products, specialized equipment, and esthetician expertise. A typical acne-focused facial includes cleansing, exfoliation, extraction, treatment mask, and moisturizer application. The extraction component, professional removal of comedones, provides benefits impossible to achieve safely at home. Hydrofacial uses suction technology to extract impurities from pores without harsh manual extraction. A spiral tip applies suction while simultaneously infusing treatment serums. Hydrofacials provide immediate visible improvement, particularly for comedones. Most people see results after a single treatment, with cumulative benefits after 4 to 6 treatments performed monthly. Chemical peel facials use professional strength acids, glycolic acid, salicylic acid, or lactic acid, to exfoliate multiple skin layers. Superficial peels cause mild redness and slight flaking but require no downtime. Medium peels cause more significant exfoliation and require several days of recovery. Chemical peels improve acne, texture, and hyperpigmentation significantly. Monthly superficial peels or quarterly medium peels provide excellent results. Blue light therapy facials use specific light wavelengths to kill acne-causing bacteria. Blue light, around 415 nanometers wavelength, is particularly effective against Cutibacterium acnes. Treatments typically last 15 to 20 minutes. Most treatment plans include 6 to 8 sessions, sometimes combined with red light therapy for inflammation reduction. Blue light therapy is particularly valuable for those seeking non-chemical treatment or for bacterial acne resistant to other treatments. Microdermabrasion facials use fine crystals or a diamond tip to physically exfoliate skin. This removes dead skin cells, unclogs pores, and stimulates collagen production. Results are immediate visible skin smoothing. Regular microdermabrasion, monthly, maintains clear skin and improves texture. Oxygen facials infuse pressurized oxygen with serums deep into skin. While marketed aggressively, evidence for exceptional benefits is limited. However, many people report improved hydration and glow after oxygen facials. Dermaplane facials use a sterile blade to remove fine facial hair and dead skin cells. This provides exfoliation and hair removal simultaneously. Results are immediate, smooth, bright skin. However, dermaplane isn't appropriate for acne-prone or actively inflamed skin, as the blade can irritate lesions. Laser facials use laser technology for exfoliation, collagen stimulation, and targeted treatment of specific concerns. Fractional laser facials are gentler than full laser resurfacing and provide results with minimal downtime. Professional facials are most effective when combined with consistent home skincare. Monthly professional treatments combined with daily clearer skin. Heat and humidity increase sebum production and promote bacterial growth, worsening acne. People living in tropical climates or hot, humid environments experience more significant acne than those in cool, dry climates. While you can't change your climate, understanding that heat worsens acne helps you implement compensatory strategies. Increase air conditioning use if possible. Use a humidifier in dry climates to prevent the skin barrier compromise that can paradoxically worsen acne. Keep skin cleaner during hot, humid times when sebum production is highest. Sweating creates moisture that promotes bacterial growth in pores. Athletes or people with active occupations experience acne worsening related to sweat. The solution is simple: shower immediately after sweating, change into clean clothes, and avoid touching your face during exercise. Exercise itself is beneficial for stress reduction and hormonal balance, so don't avoid it, just manage post-exercise hygiene properly. Friction from tight clothing, athletic equipment, or repetitive face touching, occupational hand-face contact, can trigger acne. Friction acne appears where contact occurs, under helmet straps, where backpack straps compress skin, on the jawline from phone contact. Wearing loose, breathable clothing, ensuring equipment is clean, and avoiding touching your face helps prevent friction acne. Occupational chemical exposure contributes to acne in certain professions. Workers in automotive, petrochemical, or metalworking industries' exposure to mineral oils, cutting fluids, and other chemicals experience acne, occupational acne. Wearing appropriate protective equipment, washing thoroughly after work, and changing out of contaminated clothing help prevent this exposure-related acne. Chlorine exposure worsens acne, particularly in swimmers. Chlorine is drying and irritating to acne-prone skin. Swimmers should rinse immediately after swimming to remove chlorine, wash hair to prevent chlorine transfer to facial skin, and use protective products before swimming if possible. Air pollution contains particulates and oxidative stressors that settle on skin, potentially worsening acne. People living in high-pollution areas experience more acne than those in low-pollution areas. While moving isn't feasible for most people, understanding pollution as a contributing factor helps. Using air purifiers indoors, minimizing outdoor time during high-pollution days, and thorough daily cleansing to remove particulates helps mitigate pollution effects. Secondhand smoke exposure contains numerous irritants and oxidative stressors. While not as significant as direct smoking, secondhand smoke exposure is associated with worse acne. Avoiding secondhand smoke exposure is beneficial. Stress from work, relationships, or other sources increases cortisol, promoting inflammation and acne. High-stress occupations correlate with worse acne. Implementing stress management is therefore essential. Exercise, meditation, adequate sleep, and time away from work all reduce work-related stress and its acne effects. Blue light from screens, phones, computers, tablets, may contribute to acne through unknown mechanisms, though evidence is still emerging. Some evidence suggests blue light increases inflammatory markers. Limiting screen time, using blue light filters on devices, and taking frequent breaks from screens might help, particularly for those with screen-heavy occupations. Hard water, high mineral content, may contribute to acne through various mechanisms. Installing a water softener or using a shower filter might help if you have very hard water, though evidence is limited. At minimum, thorough rinsing after cleansing ensures no mineral buildup remains. Tap water quality varies by location. Some tap water contains significant levels of chlorine or other chemicals potentially irritating to acne-prone skin. Using filtered water for rinsing after cleansing or using distilled water as a final rinse might help those with particularly sensitive skin. Hormonal disruption from endocrine-disrupting chemicals in products and the environment contributes to acne. Bisphenol A, BPA, and phthalates in some plastics can disrupt hormones. Using BPA-free bottles and containers, reducing plastic use, and choosing natural products when possible reduces exposure to potential endocrine disruptors. Occupational stress combined with other factors creates a synergistic acne worsening effect. Someone working a stressful job in a hot, humid environment while wearing work clothing that causes friction experiences multiple acne-promoting factors simultaneously. Addressing modifiable factors helps mitigate cumulative effects. Understanding your specific environmental and occupational exposures allows you to make targeted changes. If heat and humidity worsen your acne, cooling strategies help. If your occupation involves chemical exposure, protective equipment helps. If stress is primary, stress management helps. Identifying your specific environmental contributors guides your approach to minimizing their acne impact. Guide 33: Advanced Retinoid Protocols and Optimization Strategies. Retinoids represent some of the most powerful acne and anti-aging treatments available, but optimizing their use requires understanding advanced protocols and strategies beyond basic application. Mastering retinoid use transforms results. Retinoid strength exists on a spectrum from gentlest, over-the-counter retinol, to most potent, prescription tretinoin. Over-the-counter retinol at 0.25 to 0.3% concentration is appropriate for first-time retinoid users. After establishing tolerance over 8 to 12 weeks, you might advance to stronger formulations. Retinol, retinaldehyde, at 0.05 to 0.1% concentration offers intermediate strength between retinol and tretinoin. Prescription retinoids include tretinoin, Retin-A, at 0.025 to 0.1%, adapalene, Differin, at 0.1%, and tazarotene at 0.025 to 0.1%. The difference between 0.025% and 0.1% tretinoin is substantial in terms of strength and irritation potential. The start low, go slow principle maximizes retinoid tolerance. Begin with the lowest concentration at the lowest frequency, 2 to 3 times weekly. Resist the temptation to speed up progression. After 4 weeks at your current concentration and frequency, assess tolerance. If you're experiencing minimal irritation and want faster improvement, increase frequency to 3 to 4 times weekly. After another 4 weeks, increase to 5 to 6 times weekly. After another 4 weeks, use nightly. Only after reaching nightly use at current concentration should you consider increasing concentration. This progression takes 12+ weeks but maximizes adaptation and minimizes retinization phase severity. The retinization phase, temporary redness, dryness, peeling, and potential acne worsening, is unavoidable but manageable. Rather than viewing retinization as treatment failure, recognize it as adaptation to a powerful treatment. Action can also cause microtears in your skin barrier, leading to increased sensitivity and irritation. For these reasons, dermatologists typically recommend avoiding physical scrubs if you have acne. Chemical exfoliation is gentler and more effective. There are 2 main types of chemical exfoliants: alpha-hydroxy acids, AHAs, and beta-hydroxy acids, BHAs. AHAs, including glycolic acid and lactic acid, are water-soluble and work on the skin's surface. They're excellent for general exfoliation, improving texture, and reducing the appearance of fine lines. However, they don't penetrate into oil-filled pores effectively. BHAs, particularly salicylic acid, are oil-soluble and can penetrate into sebum-filled pores, making them ideal for acne-prone skin. Salicylic acid dissolves the sebum and dead skin cell plug within the follicle, directly preventing and treating comedones. For acne-prone skin, exfoliating 2 to 3 times weekly with salicylic acid is generally appropriate. Some people with very resilient skin can tolerate daily use, while those with sensitive skin may do better with once or twice weekly exfoliation. Begin conservatively with 2 to 3 times weekly, observing how your skin responds over 2 to 3 weeks before increasing frequency. Exfoliation products come in various formats. Exfoliating cleansers contain salicylic acid and are used during your regular cleansing routine. These are gentle and convenient for daily use. Exfoliating toners are applied after cleansing and before other treatments. They're typically stronger than cleansers and are meant to be left on the skin. Exfoliating serums and treatments are the most concentrated forms and are usually applied 2 to 3 times weekly. Exfoliating masks are meant to be applied for a specific duration, usually 10 to 15 minutes, then rinsed off. When starting exfoliation, begin with a lower concentration of salicylic acid, typically 0.5% to 1%, and gradually work up to 2% as your skin builds tolerance. Many beginners make the mistake of jumping to high concentrations, causing excessive irritation, dryness, and peeling. This leads them to conclude that exfoliation doesn't work for them when the actual problem was starting too strong. The exfoliation process requires proper technique. Apply your exfoliating product to clean, completely dry skin. Applying to damp skin increases irritation and reduces effectiveness. Use your fingertips to apply the product gently, spreading it evenly across your face, paying special attention to areas where acne is most prevalent. Some exfoliating products are meant to be left on overnight, while others are rinsed off after a specific duration. Follow product instructions carefully. During the initial exfoliation period, expect some adjustment. Your skin may experience mild redness, slight dryness, or mild peeling. This is normal and typically subsides within 1 to 2 weeks as your skin adapts. However, if you experience severe irritation, excessive peeling, or significant discomfort, reduce your exfoliation frequency or concentration. Listen to your skin, it will tell you what it needs. Never combine multiple exfoliating products on the same day, and especially avoid combining exfoliants with other strong actives like retinoids or benzoyl peroxide on the same night initially. This overexfoliation damages your skin barrier, causes excessive irritation, and can actually worsen acne. Once your skin is accustomed to each product individually, you can sometimes combine them, but do so cautiously and only if your skin tolerates it well. Some people experience purging when they begin exfoliation, where acne temporarily worsens as the exfoliant brings impurities to the skin surface. This is generally a positive sign that the product is working, and it usually subsides within 1 to 2 weeks. However, if purging lasts longer than 2 to 3 weeks or becomes unbearable, discontinue the product and consult a dermatologist. After exfoliating, your skin barrier is compromised and needs careful management. Moisturize generously with a product suitable for your skin type. Avoid other potentially irritating ingredients like vitamin C, niacinamide in high concentrations, or peptides on exfoliation days. Stick to basic cleanse, exfoliate, and moisturize. Use sunscreen religiously, as exfoliated skin is more susceptible to UV damage. Seasonal variations affect exfoliation needs. During winter, when skin is naturally drier, you may need to reduce exfoliation frequency. During summer, when skin is oilier and more resilient, you might tolerate more frequent exfoliation. Listen to your skin and adjust accordingly. Results from regular exfoliation appear gradually. After 4 weeks of consistent exfoliation with salicylic acid, you should notice smoother texture, fewer comedones, and generally improved skin clarity. Acne lesions should appear flatter and less inflamed. However, exfoliation is most effective as part of a comprehensive acne treatment plan, not as a standalone solution. Guide 4. Salicylic acid, the science, concentrations, and complete application guide. Salicylic acid has been a cornerstone of acne treatment for decades, and understanding its mechanism and proper use is essential for anyone dealing with acne. Salicylic acid is a beta-hydroxy acid, BHA, meaning it's oil-soluble. This oil solubility is what makes it particularly effective for acne-prone skin. It can penetrate into oil-filled pores where other water-soluble ingredients cannot reach. Salicylic acid works through multiple mechanisms. First, it acts as a keratolytic, meaning it helps dissolve the protein bonds between dead skin cells, promoting cell shedding. Inside the follicle, it dissolves the sebum and dead skin cell mixture that forms cum-dun plugs. Second, it has mild antibacterial properties, helping reduce bacterial colonization within blocked pores. Third, it has anti-inflammatory effects, reducing the redness and irritation associated with acne lesions. Fourth, it can stimulate cellular turnover, promoting healthier skin overall. Salicylic acid comes in various concentrations, typically ranging from 0.5% to 2%. The concentration directly correlates with effectiveness and also with irritation potential. A 0.5% solution is very gentle, making it suitable for sensitive skin or those new to salicylic acid. A 1% solution is considered standard for most people with acne-prone skin, providing a good balance between effectiveness and tolerability. A 2% solution is the maximum recommended concentration for at-home use, offering significant exfoliating power but requiring experienced use to avoid over-irritation. Professional-grade salicylic acid can be applied at concentrations up to 20 to 30% during chemical peels, but these are only performed in clinical settings and are significantly stronger than over-the-counter products. Salicylic acid products come in numerous formats, each with advantages and disadvantages. Cleansers containing 0.5 to 2% salicylic acid are the gentlest form. You use them daily during your regular cleansing routine, and the short contact time limits irritation while still providing exfoliating benefits. Cleansers are ideal for maintaining clear skin and for beginners new to salicylic acid. Toners or liquid exfoliants contain higher concentrations and are left on the skin, providing more potent exfoliation than cleansers. These are typically applied after cleansing and before other treatments, 2 to 3 times weekly. They provide more dramatic exfoliation than cleansers but also carry more irritation risk. Serums and treatments are concentrated salicylic. Caffeine and alcohol intake timing affects sleep quality. Caffeine consumed in the afternoon or evening disrupts sleep onset and quality. Alcohol consumption in the evening worsens sleep quality even though it might initially make you drowsy. Avoiding caffeine after 2 p.m. and limiting evening alcohol consumption improves sleep. Exercise supports both sleep quality and acne management through multiple mechanisms. Regular aerobic exercise, 30 minutes, 5 times weekly, improves sleep quality, reduces stress, regulates hormones, and improves acne. However, exercising too close to bedtime, within 3 hours, might disrupt sleep. Exercising earlier in the day optimizes both sleep and acne benefits. Sleep-specific skincare involves protective measures during sleep. Applying a heavy, occlusive moisturizer or night cream before bed protects skin during nighttime and supports barrier health. Night creams are often richer than daytime moisturizers because you don't need to worry about appearance or mattifying for makeup. Overnight hydrating masks provide intense hydration during sleep. Some people use occlusive oils, just a few drops of facial oil over moisturizer, to lock in maximum hydration overnight. Retinoid application at night leverages sleep's restorative processes. Applying retinoids in the evening, or before bed if your routine allows, means they work while your skin undergoes growth and repair during sleep. This timing often provides better results than morning retinoid application, though this varies individually. Acne spot treatments can be applied before bed to work overnight without interfering with daytime activities. Leaving benzoyl peroxide or other treatments on overnight provides extended contact time for therapeutic benefit. Silk or satin sleep masks or pillowcases are promoted for anti-aging and acne benefits. The reduced friction might slightly reduce acne, and the reduced moisture absorption compared to cotton might help slightly, but these effects are modest compared to other acne management strategies. If you like the feel of silk pillowcases and can afford them, they're worth trying, but they're not necessary for acne management. Optimizing sleep requires a multifaceted approach, maintaining 7 to 9 hours nightly, keeping consistent sleep schedules, avoiding evening screen use, limiting caffeine after 2 p.m., maintaining cool, moderate humidity bedroom, and changing pillowcases frequently. These changes take 2 to 3 weeks to impact acne, but most people notice significant improvement in acne after optimizing sleep long-term. Sleep is one of the most underrated acne management strategies. While topical treatments and professional treatments receive most attention, sleep optimization often provides dramatic acne improvement that rivals pharmaceutical treatments. Prioritizing sleep is one of the highest impact acne management strategies available. Guide 35, Water Quality, Hydration Science, and Optimal Water Intake for Clear Skin. While "drink water for clear skin" is commonly repeated, the mechanisms behind water's role in skin health and the specific amount of water actually needed for acne improvement are often misunderstood. Understanding water science and optimal hydration supports acne management. The myth that specific water quantities, 8 glasses daily, etc., directly treat acne is oversimplified. While adequate hydration supports overall health and skin function, consuming excessive water beyond your actual hydration needs doesn't further improve acne. However, maintaining proper hydration throughout the day supports skin health in multiple ways. Dehydration compromises skin barrier function. When your body is dehydrated, your skin compensates by producing more sebum to maintain oil barrier protection. Paradoxically, dehydrated acne-prone skin often appears oily while being dehydrated internally, creating conditions promoting acne. Proper hydration reduces this compensatory sebum production. Hydration supports skin cell function. Skin cells require water to function optimally. Proper hydration maintains cellular processes, supports detoxification, and promotes overall skin health. Dehydrated skin appears duller and is more prone to irritation and breakouts. Hydration supports immune function. Adequate hydration maintains lymphatic function and immune cell circulation, supporting your body's ability to fight acne-causing bacteria. Dehydration compromises immune function, potentially worsening acne. Hydration supports blood circulation. Well-hydrated blood flows more efficiently, delivering nutrients and oxygen to skin cells. Dehydration compromises circulation, reducing nutrient delivery to skin. Optimal daily water intake varies based on body weight, activity level, climate, and individual factors. A general guideline is 35 milliliters per kilogram of body weight daily. For a 70 kilograms person, this equals approximately 2.5 liters, about 10 glasses, daily. However, individual needs vary significantly. Thirst is a reasonable indicator of hydration needs. Drinking when thirsty and monitoring urine color. Pale yellow indicates adequate hydration, dark yellow suggests dehydration, guides appropriate intake. Individual variation in optimal water intake is substantial. Some people need 2 liters daily for optimal hydration, while others need 3 to 4 liters depending on activity and climate. Rather than following a rigid 8 glasses recommendation, assess your personal hydration status and drink accordingly. Water intake timing matters somewhat. Distributing water intake throughout the day maintains consistent hydration better than consuming large amounts at once. However, excessive water intake shortly before bed disrupts sleep through nighttime urination. Tapers off water intake 2 to 3 hours before bed to optimize sleep quality. Electrolyte balance matters for hydration beyond pure water intake. Excessive water intake without sufficient electrolyte intake, sodium, potassium, magnesium, can disrupt electrolyte balance, causing problems. Consuming electrolyte-containing beverages or foods alongside water maintains balance. However, the Western diet typically contains adequate sodium, so electrolyte concerns are minimal for most people unless they're exercising extensively or sweating significantly. Water quality affects skin and acne through multiple mechanisms. Hard water, high mineral content, leaves mineral buildup on skin, potentially irritating it and compromising cleansing efficacy. Soft water cleanses more effectively. If you have very hard water, installing a water softener or using a shower filter might help. However, evidence for hard water directly worsening acne